Hey everybody, this is Dr. Daniel Choi here from North Texas Dental Surgery Wisdom Teeth and Denture Implant Center.
And I'm Dr. Adam Bellingham from the Grapevine Dentist.
Alright, so today we are going to talk about partial dentures versus full dentures, what we should do maybe to decide one versus the other.
Yeah.
Before we head into that, if you could give us a follow on our Instagram and our YouTube channels, North Texas Dental Surgery for Instagram and YouTube.
And the Grapevine Dentist for both.
Alright, for your Instagram and YouTube.
Yes. Yeah.
Alright, cool. Now, quick question. So we were just talking about, because we saw a comment for a patient, they're saying, all right, they heard some horror stories about dentures. Should they try to save as many teeth as possible and head to a partial denture? Or should they just be like, to hell with it, I want to just head straight to the complete denture in the end, save myself the money, I hate going to the dentist, I don't want to go in again one day. So what are your thoughts?
So yeah, those are definitely some valid questions.
Right.
And there's a couple criterion ways you can kind of go about looking at that kind of thing.
Right.
So from a function standpoint, if the most important thing to you is ability to chew well,
Right.
then save the teeth worth saving and do a partial.
Wait, I'm sorry to interrupt. Save the teeth worth saving.
Yes.
Worth saving. That's a huge thing.
Yes.
Because we see some people, some dentists, trying to save teeth that shouldn't be saved.
Don't need to be saved.
And then when they do that, and then they make their partial denture, and they invest all that time and money into it, the partial denture stays in place because it wraps around the existing teeth that you have.
Yeah.
So if that existing tooth, which is a pillar of support, is now gone, then your partial denture might be rendered useless.
Yes,
right?
Yeah. To backtrack to exactly what
Yeah.
you were saying, if I'm evaluating you for what teeth to keep, and we know, so a partial is held in by some little metal wires or clasps, as we call them, that let it snap
Little hooks,
on
right?
and grab on. Yeah, that grab on to your existing teeth and use those to hold it and anchor it in place.
It's almost like it's trying to hug on to your tooth. Right?
Exactly.
Yeah.
And so you need those teeth that you're going to attach that partial to be strong, because they're going to be taking a little extra force holding that in there.
Now sorry to keep interrupting.
No.
But strong in bone support.
Yes.
There needs to be a lot of bone around that root,
Yep.
so no periodontal issues or gum disease issues. And then also for what you deal with, no cavities, right?
Yeah, no cavities, and probably not a heavily restored tooth.
Right, like
As
a
in,
monster crown.
Yeah, something that's got a root canal and a giant post and a crazy crown on it. Like that, you're going to put extra force on that, and that whole thing's going to break off.
Right,
you want a tooth that's kind of been minimally restored, or a single crown with a lot of tooth under there to be nice and strong.
Right.
That kind of thing. Just solid anchor teeth to hook that to.
Right.
So ones that are not that, don't sink a bunch of money into saving those. Let those go to keep the good ones so you can have a long-lasting partial. So if you're looking at chewing, being able to snap it onto some existing teeth makes that partial a lot more stable.
Right.
It's not just resting on gums, it's now got some solid teeth support.
And we want as many people, there's a hurricane coming through, like they say, in the next day. I don't remember, is it Ida or something like that?
Something that.
It's a hurricane about to hit
that.
Louisiana, north, in the next few days here at the end of August 2021. The reason I say that is imagine there's strong winds coming through. We're gonna try to hold on, a group of us are gonna try to hold on to as many trees or whatever as possible, right?
And the strongest one we can get our hands on.
Right. And the partial denture, what we want to do is we want to hold on to as many good teeth again as possible. So don't just suddenly try to build a partial off of 2 remaining good teeth, or saying what I'm trying to get across is if we were running out of too many good teeth, is a partial really an option, right?
Yeah.
So can you talk a little bit about that?
It's also dependent on how many of those good teeth you've got.
Right.
You don't want to. You can make a partial on anything, but is it going to function well? No. And and is it going to look good? But you need to have a certain amount of good teeth for stability for that partial to really have more stability than a good fitting denture.
Right.
So if you've got a decent number of good teeth and you're looking at function, by all means, partial for upper and lower is the way to go.
Right.
Now then, the other caveat to look into it is aesthetics.
Right.
What do you want something to look like? So for example, say you're missing a couple back teeth, but you're also missing a single front tooth.
Yep.
And you've got, not a lot of teeth in there, but you're missing like a single front tooth. And trying to do that in a partial, because a partial has to come in and out, for that to draw that partial tooth up next to a single front tooth is not going to look that good, because it's going to have gaps on the side, because it's got to be able to come on and off.
Yep. So trying to make it look natural is very
it's going to be
difficult.
tough to make it look natural.
And function properly.
Exactly.
Right.
So in a situation where, say you've got a lot of bone loss on front teeth and they don't look that good and they're not stable, and replacing one here and one here and one here with a partial, that's not going to be a very aesthetic result.
Right.
So in that situation, a full denture might be your better option.
Right. So, to kind of like get, really cut to the chase to help these patients really understand, let's say that they just know that they have some bad teeth and they're like, but I heard dentures are horrendous. So I don't feel like a lot of my teeth are that bad. So can I do a partial? And then maybe I don't have enough money to do like an all-on-4 or snap-on denture, right?
Yeah.
So this is like who we're trying to really address, right? But what you really need to understand is, yeah, you're absolutely right. If you have enough good teeth to be able to support a partial denture, do that hands down over a complete denture. However, that is only good for people who are more functionally driven, because if aesthetics is a high concern for you and you have a high smile line, like meaning that you show a lot of gums too or your teeth, then it's really difficult to control the aesthetics sometimes for some of these partial dentures.
Yeah. And it's very case dependent, so by all means ask your dentist.
Exactly.
But the other thing you have to keep in mind, for if you're doing a partial, you need to maintain those anchor teeth. Mm-hmm. If the reason you're in the situation of needing a denture or a partial is you've got a lot of decay, or you haven't been the best about brushing and flossing, and we'll just be honest.
You got a lot of bone loss.
You got a lot of bone loss. You haven't really been taking care of your teeth, and you're not really interested in changing those habits. A partial is not going to be for you,
right?
Because a partial, the way that it sits against teeth and stuff, they can catch food, whatnot from eating. You have to maintain those anchor teeth to get the benefit of having the stability of a partial. If you're not interested in maintaining those teeth, well, then you're just wasting money on it.
Yeah, and I'm glad you brought that up, because I feel like a lot of times, like, there isn't that conversation with the patient.
Yeah.
They kind of got to this point because of, no offense, like they didn't have the time to go to the dentist, or maybe dentistry wasn't a priority.
Or didn't have the funds at the time, or for
exactly.
whatever reason.
And then, like, yeah, and not to demonize any reason, like,
No,
life happens, right? We totally get it, right?
Yeah.
And, like, we joke around all the time. We don't like sitting in that dental chair either, right?
No.
But is it smart to put somebody in a partial denture if they're going to keep going down that path, and then 2 years later, that time and money that they invest? Because even to get those stabilizing, what we call abutment teeth, the teeth that we're going to like kind of like wrap around and like use as supports, if we like sometimes in order to fortify some of those teeth,
we have to do work to those teeth.
Work and money.
Yeah.
Right.
Sometimes those teeth we're going to use might have some cavity and then they need fillings, or they need crowns, or you have to get your foundation in good shape first, which means also you may need some periodontal therapy, deep cleanings or regular cleanings or what have you. There's an investment of time and effort that's being made to make those teeth strong enough, and then to make a good fitting partial. And that's an investment you're making into those teeth, and you've got to maintain them.
Right.
If you're, for whatever reason, that's not the road you want to go down, then a partial is not for you. We're just wasting your money, trying to get you to spend a bunch of money on teeth that you're then not going to take care of.
100%. So then you might as well go to complete denture. However, remember at the beginning of this conversation, we were talking about a partial denture has a significant advantage over a complete denture due to function.
Yes.
Right?
Yeah.
And so that's when you're in now a denture, and then that's when we also see tons of patients come in for snap-on dentures or all-on-4, because when patients are in a regular denture, they're the aesthetics may be good, but the function is extremely lacking,
it's
right?
compromised for
And
sure.
so, what good is looks if you can't eat?
Yeah,
Right.
yeah.
So then you have to start talking about the snap-on denture.
Yeah, and that's where you
for.
can go in with implants and things like that to augment that,
Exactly.
that denture.
Right. So not to always send people into the implant arena, but for example, if you are in a partial, just main point, take care of those teeth.
Yes.
Make sure you're seeing a good
Yes.
dentist. Sometimes we'll see dentists that I've seen people, like these dentists try to put these people in partials, and I'm like, what are you thinking?
Yeah.
That tooth is already wiggling around in the first place because
Yeah.
of bone loss.
And the worst part about that is if someone didn't bother to address or remove or whatever those subpar teeth for anchors, ones that aren't that good. Okay, well, say you lose that tooth and that was the one that your partial clamped onto and held onto. You got to make a whole new partial.
Yep.
I mean, you can't. There's very limited things you can do to modify a partial.
Yeah.
I mean, in some instances, you can add some teeth and modify clasps to an extent.
Yeah.
But I can guarantee you, from years of doing it, they never fit like they used to.
Yeah.
And there are times where you can't modify that extensively, and you
Yeah.
just got to do a whole new partial.
I've seen so many patients that have had partials made and it sits in their nightstand
Yep.
for one reason or the other.
Yeah.
When the dentist took some shortcuts, never fit right in the first place.
Mm-hmm.
Other reasons is they lost a tooth and it became irrelevant.
Yeah,
the whole
it's
thing
no longer
had
a
to scrap it.
functioning thing. Yeah,
Yeah.
you got to toss it.
Yeah.
Yeah.
Anything else to add?
Not really. I mean, really kind of to sum things up, if you're mainly looking for function, then partials are a better option for function, but you are making an investment in needing to shore up those remaining teeth and maintain those teeth
Yeah.
to get your money's worth out of what you're doing.
Yeah.
If that's not something you're interested in, dentures are a better option for you. Or if we are heavily aesthetics driven and we don't think we're going to get the aesthetic result that we want out of a partial,
Right.
we may need to have that denture conversation.
Right. Okay. Well, thanks for that info. That's very
course.
helpful. If you guys like this content, please give us a thumbs up. Follow our channels on North Texas Dental Surgery and
And the Grapevine Dentist.
on both YouTube and Instagram. All right, thanks, guys. See you later.
Thanks.